weather and shorter days, but it's also an important time to check in on your mental health and that of those you love. September and October focus on suicide prevention and mental health awareness. We've got Jenalyn Jubek. She's an outpatient clinician at Forest View Hospital to talk to us more about this. You know, this is something we should be thinking about all the time, but there's a specific focus this time of year. Talk to us about that.
Yes, so September is our National Suicide Prevention Month. Suicide is still a significant issue across our country and still one of the leading causes of death in our state. People of all races, socioeconomic statuses, genders are at risk of suicide.
Yeah.
It is important to note that more women do attempt suicide than men, but men are 4 times more likely to die by suicide.
Wow.
Actually, 79% of men are the individuals that die by suicide.
Okay.
Men 50 and up are actually more at risk for suicidality. With that being said, suicide is the second leading cause of death for individuals 10 to 14, third leading cause of death for individuals aged 15 to 24, and still the 12th leading cause of death for individuals in our country.
Wow. I mean, those are some pretty staggering statistics. And yes, it is anyone, you know, all different people. And so talk about us, you know, mental health awareness is October, correct?
Mm-hmm. Yeah.
You know, a natural follow. And so talk to us about what people need to think about when they're thinking about their own mental health and the people that they love.
Mm-hmm. Yeah, so October is National Depression Awareness Month. And the purpose of this month is to educate the public on how to seek out help if they're experiencing symptoms of depression or mental illness. The purpose of this month is also to end stigma that still is prevalent with mental illness in our community.
And so talk to us about the symptoms that people should be looking out for, because I think a lot of people still are in this mindset, like, snap out of it, you know, be grateful. Mm-hmm. It's not that bad, things like that, and how people need to approach that and what people should be looking for inside themselves if they think they might be struggling.
And depression and all mental illnesses look different for everyone. But some physical signs that you can look out for are a change in appetite, a change in sleep patterns, becoming more easily irritable, or having difficulty coping with daily stressors, engaging in unhealthy coping skills such as substance use, gambling, excessive spending, self-harm are all physical signs of potential depression or mental illness.
Okay. And so if someone's not feeling well, or if they're exhibiting any of these signs, what should they be doing?
Well, you can come to our hospital for help. We do have 3 levels of treatment. Our first level of treatment is our outpatient medication management clinic, where patients are able to receive a psychiatric evaluation and then obtain prescriptions for medications. We then also have a partial hospitalization program that can serve as an alternate to inpatient.
Sure.
It can also act as a step down from people discharging from our acute inpatient stay. And it can also be used to prevent inpatient hospitalization.
Okay.
I think there's a misconception out there that if you seek treatment for mental health, you're going to end up in an inpatient facility,
Sure.
and that's just not the case.
Okay. Lots of different options,
yes,
depending on what you might need. So what do people need to do if they think that they need to reach out to you and they need to try to find help and figure out what their options are? What should they do?
Definitely go to our website, www.forestviewhospital.com. Give us a call. You can reach out and schedule a comprehensive intake assessment. And you can always, always, always utilize the National Suicide and Crisis Hotline at 988.
988 all the time. Okay. Thank you so much. We appreciate all that information. Again, forestviewhospital.com. You want to learn more about the programs you can access locally, and that number there on your screen, 800-949-8439.